Welcome back. To continue our discussion or complete it on men's health, joining me again is Dr. Eric Wallace, Associate Professor, Internal Medicine, University of Oklahoma School of Community Medicine, and OU Physicians in Tulsa. Now let's jump in on this last segment. I want to kind of hit three areas if I can. I want to look at, let's look at the prostate in terms of prostate health for men. Tell me about that.
Well, in terms of prostate cancer, it's the #2 cancer killer among men. It's about a third or a fourth as common as lung cancer. But prostate cancer is something that men very much are concerned about. But the problem with prostate cancer is we don't have a perfect screening test for that. Once you turn age 50, you should get a yearly, what we call a digital rectal exam, so where your doctor actually palpates or feels your prostate to see if there's any abnormalities to it. And the other part of prostate cancer screening is a PSA test, or a prostate-specific antigen. And there's a lot of controversy surrounding that now. The best way I can sum it up is if your PSA level's high, you may or may not have cancer, and if it's low, you may or may not have cancer.
Okay.
So it's, but you can get two groups of doctors looking at the same data on PSA testing, and they'll come to two totally separate conclusions on the benefit of it. But overall, there's not really a well-documented mortality benefit, meaning PSA testing has not been clearly shown to reduce deaths from prostate cancer. So it's one of those tests, kind of like, mammograms, for instance, where you need to discuss the risk and benefits of the testing. And there are significant risks of this testing, going through a fairly painful biopsy, which if you've seen one, it's pretty uncomfortable. But then you may actually detect a prostate cancer and get treated for it, which may lead to impotence, incontinence, and so forth. But what they found is that 2/3 of men who die of other causes, who have an autopsy at age 80, they actually have prostate cancer in their system, but they never died from prostate cancer.
Wow.
So we're not very good at detecting the prostate cancers that will actually advance and lead to one's death from prostate cancer. So that's the other downside, is you may detect a prostate cancer that never would have affected that man at any point in their life. But we don't know how to distinguish between the ones that are aggressive and the ones that aren't at an early stage yet.
Okay, so with the test then, like you're saying, if it comes back as a positive, depending on the physician, a biopsy is going to be indicated.
Potentially, but there's other things that can cause your PSA levels to be high. You could have infection or inflammation in your prostate, or you just may have an enlarged prostate that can lead to a high PSA level, but that doesn't lead to an increased risk of cancer.
Right. So if that's the case, like you said, the male needs to really talk with their physician about what this is really saying and what are my options and testing. And so does it mean then for men that the digital rectal exam, palpating the prostate, is that the most valuable on a yearly basis?
Well, even that's not the best test to detecting prostate cancer, but if your doctor detects an abnormality on your prostate, there's pretty clear consensus that you do need to see a urologist to potentially have that biopsy.
Okay. Now, if there are some concerns or problems with the prostate, are there going to be other symptoms that the male may experience in terms of anything, urination, of any type of function? Tell me about that.
Well, most of the symptoms that a man feels due to his prostate has nothing to do with cancer. If you get symptoms from prostate cancer, it's usually advanced to a very late stage and is spread to other places. So advanced prostate cancer likes to metastasize to the bone. So you may, you may get bone pain from that prostate cancer. But most prostate symptoms are due to an enlarged prostate, which generally is not cancerous. So it's going to be difficulty starting your urine stream, difficulty emptying the bladder, having this urgency that you need to go to the bathroom right away. Those are more symptoms of an enlarged prostate, and there are fairly good medications to help treat that these days.
What about if there's burning on urination? Does that, is that something that males need to be sensitive to as well and getting into the doctor versus, it'll probably go away?
Right. For men, if it burns when you urinate, there's generally a problem there, and that could be anything from a urinary tract infection, it could be a sexually transmitted disease, it could be a kidney stone, but in general it should not burn when you urinate, so you should see your doctor about that.
Okay, what about the consistency of the urine or the color of the urine? Should any of that be a trigger for the male to get in?
I would say if you see blood in your urine, especially after the age of 50, even if you don't have pain associated with it, that's a concern for a possible cancer developing. But if it's yellow, light yellow, that's generally not a problem. But if it's tea-colored, even just a few drops of blood in your urine can turn it to this tea-colored or dark brown color that probably should be investigated, at least with a test for the urine.
Okay. Now, I want to talk a little bit too about colon cancer really quickly for males, because that's a big area. Tell me about that and the symptomology and what should men do in terms of screenings for colon cancer.
Right. So again, when you talk about screening tests, you're talking about doing a test in someone who has no symptoms. So for colon cancer screening for the average man, we're talking about starting at age 50. And there's several different things you can do. You can check the stool for blood. With a simple test that you can do. You can do a flexible sigmoidoscopy. You can do and a colonoscopy. And there's a few other tests as well. There's a virtual colonoscopy, which is a radiology test, but that's sort of in the early stages of development. But the one that most doctors recommend these days is a colonoscopy. It's not the best test from a screening standpoint because it's fairly expensive and there is risk involved of doing that invasive test. The good news about colonoscopy is that you can visualize the whole colon, and if you see an abnormality or a polyp or a suspicious lesion that's there, the gastroenterologist or surgeon or whoever's doing the colonoscopy can go ahead and take a biopsy of that on the spot. So that's the good news about the colonoscopy. The bad news is, and the worst part for the patient actually is not the colonoscopy itself, but it's the bowel preparation you do the night before to clean out your colon. That tends to be the most miserable part of that experience. And most men don't even remember the colonoscopy because they're usually sedated through that procedure.
But that's very critical because I know I've run into a lot of men who've never had a colonoscopy.
Correct.
And maybe, and some of the advanced signs, because I had an uncle that was affected with that, some of the advanced signs could be constipation. I mean, when it's really advanced. So tell me really quickly about that. When you don't want to get to this stage, but if you get these types of symptoms, you definitely need to get into the doctor.
Absolutely. So especially if you see any blood in your stool. I mean, that's a big red flag. And especially as you get older. Once you get past the age of 50, your risk of developing cancer, colon cancer goes up quite a bit. But if you have an early family history of colon cancer, that should also prompt you to talk with your doctor about maybe getting colonoscopies or cancer screening sooner. But blood in the stool, constipation that was never there before, weight loss especially, and there's several other symptoms you want to be aware of. But those ones in particular, you definitely need to see your doctor about.
Well, I'm out of time, doctor, as usual. I'm going to have you come back and pick up on men's health too, because there's many other areas that we did not talk about.
Absolutely.
Thank you so much.
Thank you.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your questions, comments, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And don't forget to visit me on YouTube at youtube.com/Health Alert USA. Take care, and remember, get in to see your doctor, talk to your doctor. If you don't have a health care provider, call around, get yourself one, and get checked. Take care. This program would not be possible without the support of OU Physicians in Tulsa.